Imagine giving birth without any pain medication, epidurals, or hospital interventions. Imagine laboring at home with only family support and natural methods. While modern women fear childbirth and require extensive medical assistance, Amish women approach birth fearlessly. They've mastered something that could revolutionize how we think about bringing babies into the world: home birth preference. Most Amish children are born in the comfort of their homes, where birth provides a familiar and secure setting that hospitals cannot match. Home birth greatly reduces the cost of delivering a child compared to expensive hospital procedures that can financially devastate families. These births feature touching acts of care that reveal deep community bonds. Fathers share small battery-powered fans during hot summer labor nights. Aunts serve as experienced midwives, drawing on generations of birthing knowledge. The same trusted doctor who delivered the mother now delivers her children, creating precious generational medical relationships that span decades of family history. Midwife traditions. Midwives handle most Amish deliveries, with some licensed professionals and others practicing through traditional community training. These may be non-Amish practitioners or women from within the Amish community itself who have gained experience through years of attending births. The most famous was Bill Barb Hochstetler, an Amish midwife who delivered hundreds of babies in her own home, becoming legendary throughout the Holmes County settlement. Birthing centers discharge patients to family care just 4 hours after giving birth, a practice strongly preferred by Amish families who value immediate family integration over extended hospital stays. However, legal challenges persist. The state once sued a lay midwife in Mercer County for delivering hundreds of babies to Amish women, highlighting ongoing tensions between traditional practices and modern medical regulations. Natural pain management. Amish women don't take any pain relief during childbirth. They don't allow doctors or medical professionals to give them anything that will soothe the pain during labor and delivery. For the Amish, childbirth is like any other demanding chore that needs to be completed successfully through determination and faith. At home, there is simply no pain medication available, forcing women to rely on natural coping mechanisms. They use instinctual pain management techniques, varied positioning, and natural breathing methods that have been refined over generations. The famous fear-tension-pain cycle works in reverse for Amish women. Because they don't fear childbirth, they experience no tension, which dramatically reduces their pain. One Amish client's only sign of active labor was leaning forward, holding onto a table, and letting out a small grunt. Moments later, she was ready to push. Birth locations. Amish women give birth in 3 distinct places: their homes, specialized birthing centers, or hospitals when complications arise. The choice often depends on the family's specific Amish affiliation and their comfort level with medical intervention. Conservative Schwarzentruber Amish families choose hospital births only 1/5 of the time, compared to 3/5 for more moderate Old Order and New Order Amish groups. This dramatic difference reflects varying attitudes toward modern medical assistance within different Amish communities. Amish-oriented birthing centers like the Mount Eaton Care Center in Ohio and New Eden Care Center in Indiana have been built specifically to serve plain communities. These facilities handle over 500 births yearly, with 60% occurring in the center's 3 comfortable inpatient rooms designed to feel more like home than hospital. These centers discharge patients to family care just 4 hours after birth, compared to typical hospital stays of 1 to 3 days. However, they cannot provide advanced medical treatment or perform cesarean sections. When surgical procedures become necessary, they transport patients to nearby hospitals. Women who choose home birth deliver in their own beds, surrounded by familiar surroundings and family members who provide emotional support throughout the entire labor and delivery process. Financial consideration. Very few plain families carry traditional health insurance, as it simply isn't part of their cultural tradition or religious beliefs about community mutual aid. Since Amish don't carry commercial insurance, hospital births create significant financial challenges that many families cannot afford. Amish and Mennonite families pay cash for all medical services and usually negotiate reduced prices with healthcare providers. Some medical doctors who work extensively with Amish communities offer their plain patients significantly discounted rates to ensure access to quality medical care when needed. When families cannot afford required services, they reach out to their church districts or community aid groups for financial assistance. If a hospital presents a bill the family cannot settle, the entire Amish church and its members collectively contribute to pay the outstanding medical expenses. This community support system effectively replaces commercial insurance through shared responsibility and mutual aid. Home birth can reduce delivery costs by thousands of dollars compared to hospital procedures, making it financially attractive beyond cultural preferences. Midwives and birthing centers operate for substantially less than hospital costs, providing quality care at affordable prices. Community fundraising through annual benefit auctions regularly supports medical expenses, with gift certificates for midwife services valued at $1,000 to $1,200 auctioned to help families prepare for upcoming births. The cash-only economy eliminates insurance dependency that financially burdens many modern families, creating economic freedom that supports their preference for traditional birthing methods. Family integration. Amish women receive extensive help and support from family members, children, husbands, and community members experienced with home births and traditional birthing practices. This comprehensive support network ensures no woman faces labor and delivery alone or without experienced guidance. Most Amish families have 5 to 10 children per couple, creating large family units that function as cohesive economic and social units. Having many children creates stronger families working together rather than individuals struggling separately, with each new child contributing to household productivity and community strength. Children regularly witness the natural birth process in families with 15 to 17 children, making childbirth a normal, anticipated event rather than a medical emergency requiring fear or anxiety. However, Amish families do not discuss sex, pregnancy, or birthing details with children, even when babies are born at home. The special birthing gown symbolizes strength and resilience for mothers during childbirth, honoring the tradition of strong women who have successfully given birth for generations. Children are considered joyful and welcome family members who can help with daily chores, contribute to family businesses, and continue precious cultural traditions. Setting medical due dates is considered absurd interference with natural processes. Amish families believe that nature and divine providence will decide when babies should arrive, making scheduled cesarean sections and labor inductions extremely rare, except for genuine medical emergencies. Birth by lamplight often includes sharing popcorn, a favorite Amish snack that brings normalcy and comfort to the intense experience. The immediate family support system continues long after birth, with older women staying until self-trained, unmarried Amish nurses arrive to provide professional postpartum care. These specialized nurses earn their living traveling from one new mother to another, acting as both medical caregivers and surrogate parents to other children in the household during the mother's recovery period. Medical challenges. According to traditional Amish customs and beliefs, women historically do not seek prenatal care during or after their pregnancies, relying instead on natural indicators and community wisdom to monitor maternal and fetal health. This approach results in a significantly increased number of unanticipated complications at birth compared to populations receiving regular prenatal medical care. Hospital research consistently shows that the safest place to have a baby is in a properly equipped medical facility with trained professionals and emergency intervention capabilities. Some medical professionals openly criticize the varying levels of care found among Amish-patronized birthing centers and traditional midwifery practices. Ongoing controversy surrounds the licensing of midwives, with legal cases brought in Pennsylvania and Ohio against practitioners for working without proper licenses and illegally administering prescription drugs. However, some Amish women, particularly those with high-risk pregnancies due to medical conditions, advanced age, or previous complications, do choose hospital births with full medical intervention. Special cases like breech presentations, multiple births, or other complications usually require immediate hospitalization and surgical delivery. Qualified doctors remain available at short notice and are present at many home births to handle unexpected emergencies. Unfortunately, some herbal preparations used to accelerate labor or reduce pain can cause negative consequences, including liver damage and dangerously elevated blood pressure. Recent trends show an increase in hospital births as plain families receive educational outreach about safety benefits, suggesting gradual acceptance of medical intervention when appropriate for maternal and infant health. Herbal remedies. Amish communities utilize various natural remedies designed to make birth occur faster and be less painful, drawing on centuries of accumulated botanical knowledge passed down through generations of experienced women. Various herbal preparations are used during the prenatal period to prepare the uterus and cervix for childbirth, with specific timing and dosage recommendations based on traditional practice rather than clinical studies. The famous 5-week formula combines 10 different herbs used during the last 5 to 6 weeks of pregnancy, specifically to facilitate easier birth and shorter labor. Motherwort is used specifically to treat labor pain and enhance physical endurance during prolonged delivery, while raspberry leaf consumed from 32 weeks of gestation has been shown to shorten the second stage of labor by an average of nearly 10 minutes. These herbal formulas reportedly have calming and relaxing effects on laboring mothers, reducing anxiety and promoting natural labor progression. Aromatherapy using essential oils extracted from botanical sources treats the mind, body, and spirit simultaneously during the intense birthing process. Massage with jasmine, juniper, geranium, clary sage, rose, and lavender provides subjective pain relief and emotional comfort. Postpartum recovery often includes concoctions of honey, lemon, pepper, and horseradish to restore energy and promote healing. However, medical professionals warn of negative consequences from some herbal preparations, including serious liver damage and dangerous hypertension. Few herbal remedies have undergone rigorous scientific scrutiny or proper toxicity testing, making their safety profiles largely unknown despite generations of traditional use. Birthing gown traditions. The Amish birthing gown represents a centuries-old tradition worn by women during labor and delivery, remaining virtually unchanged through generations of faithful use. This simple yet meaningful garment consists of a long, loose-fitting dress tied at the waist and a cape or shawl designed to cover the shoulders modestly. Constructed from natural fabrics like cotton or linen, the gown allows easy movement and access during childbirth while maintaining the modesty values central to Amish culture. These garments usually come in light colors, with delicate embroidery around the neckline or hem, created through hours of careful handwork. The cape or shawl serves multiple practical purposes, keeping the mother warm during long labor, providing additional modesty while undressing, and later covering the baby's face during baptism ceremonies. Beyond functionality, the birthing gown symbolizes strength and resilience for mothers during